Assalamu alaikum. Good morning, everyone. Thank you for being here today. Infection Control Experience of Diploma in Midwifery students, presented by Diploma in Midwifery second year and third year students from Shyamoli Nursing College. I am Jhumur Khanum. Let me quickly introduce our another team member, Sweetie Chakma, Mahisha Akhtar Mahi, Israt Jahan Sadia, Rima Akhtar, Poppy Akhtar. Now I am presenting on infection control. Objectives include spread of microorganism, nosocomial infection, precaution of infection control, barriers of infection control, prevention of infection control, role of infection control of midwives. Definition of infection control. Infection control is the practice of preventing or stopping the spread of infection. It's a vital part of healthcare and it applies to hospitals, clinics and other healthcare settings. Thank you for hearing me. I would like request to Sweetie Chakma, please running our presentation. Thank you.
Thank you. Thank you, Jhumur, for inviting me. Namaskar, I am Sweetie Chakma. Now I will discuss my agenda, the spread of microorganism and important. The spread of microorganism from patient to patient, patient to staff member to patient, staff member to staff member. Infection control important in healthcare facilities. Infection can increase healthcare costs and cause inconvenience, pain or even death. You may be exposed to germs that can make you sick and possibly keep you out of work. You could also spread illness to your family and friends. You are a major factor in preventing the spread of infection to others. Thank you. Now I will invite our team member, Mahisha Mai. Please continue our presentation.
Thank you, Sweetie. Assalamu alaikum. I am Mahisha Akhtar. Now I am presenting about my slide. Nosocomial infection and common types of nosocomial infection. Nosocomial infection, a hospital-acquired infection, also known as a nosocomial infection, is an infection that is acquired in a hospital or other healthcare facilities. Common types of nosocomial infection including pneumonia, urinary tract infection, surgical site infection, bloodstream infection, and gastrointestinal infection. Thank you so much. Now I request to Sadia, please continue our presentation.
Thank you, Mahisha, to give me the opportunity. Assalamu alaikum everyone. I am Sadia, Diploma in Midwifery second year. My presentation slide is infection control based on two types. Number 1 is standard precaution and number 2 additional precaution. Standard precaution means are a set of practice that prevent the spread of infection in healthcare setting. They apply to all patients regardless of whether they have an infection. Standard precaution steps: hand washing, protective equipment, sterilization, decontamination, cleaning and waste disposal. Additional precaution involves airborne precaution, droplet precaution, contact precaution. Barriers of infection control are as following: human factors, resource limitation, systemic barriers, environmental factors. Thank you so much for listening to me. Please come, Rima, and carry on our presentation.
Thank you, Sadia, for calling me. Assalamu alaikum. I am Rima. I will discuss my matter. I tell you how we can prevent infection. Prevention of infection. Prevention of infection control refers to the practices and procedures implemented to stop the spread of infection. It has key aspects of infection control prevention: hand hygiene, respiratory hygiene, self-serve management, personal protective equipment, environmental cleaning, waste management, aseptic techniques. That much. Thank you all for giving me amenities to speak. Now, I will request my next team member, Poppy. Please perform your next matter.
Thank you, Rima.
Assalamualaikum. Good morning. My name is Poppy Akhtar. Now I will describe the role of infection control midwives, patients' education, strict adherence to hand hygiene protocol, proper use of personal protective equipment, monitoring for infection sign, environmental cleanliness, antimicrobial stewardship, collaboration with infection control teams, surveillance and monitoring. Now the floor is open for discussion. Any questions or comments?
Yes, I have questions. Which bacteria causes nosocomial infections? Please give the answer.
Thank you for your question. Now I will tell your question answer. Bacteria causes nosocomial infection including E. coli, aureus, Klebsiella, Enterobacter and Staphylococcus. Thank you. Any question? Thank you so much. Any question?
Yes, I have a question.
What is meant by personal protective equipment?
Thank you. Now I can tell about protective equipment like gloves, gown, masks, head covers, shoe covers, respirators, eye protection and face shield. I think now you can understand.
Yes, I understand. Thank you so much.
Any question?
Yes, I have a question. The question is, how can we practice respiratory hygiene? Please tell me the question answer. Thank you.
Thank you for asking. I will try about give a specific answer. Your question, how can we practice respiratory hygiene? We practice respiratory hygiene covering mouth and nose when coughing or sneezing with a tissue or elbow. Thank you. Any question?
Thank you so much for your answer. No, I don't have any question. Thank you so much.
Thank you.
Thank you so much, Director Sir. Thank you so much, Assistant Director Sir, Nursing Superintendent Ma'am, Doctor Ma'ams, and thank you so much, our course coordinator Sir, teachers, everyone for being here and listening to our presentation. Thank you so much.
That